program.
What you talking about?
The program. The program. Get with the program.
Everybody clap to this. Say what?
Get with the program.
It starts now.
Hello and welcome to Get With The Program Radio Show. I'm your host, Gary Jones. Now, Get With The Program Radio Show is a multicultural, informative, relevant, and entertaining one-hour weekly show offering you a combination of diverse interviews with questions and comments. And as always, we will act as a positive source of information. Now, listen, if you want to be a guest on the show, all you have to do is log into www.getwiththeprogram.biz. Shoot me an email, leave me a message. You never know that you may have a conversation that we would love to talk about. Or give me a call at 919-665-1118. Again, that's 919-665-1118, or hit me on the cell 255-2757. Now listen, today we are going to be joined in a conversation with Dr. Vincent Allison III. Now, Dr. Vincent Allison received his Bachelor of Science degree cum laude from Morehouse College in Atlanta, Georgia in 1983. He then went on to attend the University of North Carolina School of Dentistry in Chapel Hill, North Carolina, where he received his Doctor of Dental Surgery degree in 1987. Now, he began practicing dentistry in 1987 at the Bertie Citizens Family Dental Clinic in Windsor, North Carolina. Now, in 1992, he became the dental director of Stedman Family Dental Center in Stedman, North Carolina. Dr. Allison returned to Durham in 2001 to begin a private family and cosmetic dental practice. Hello, Dr. Allison, and welcome to Get With The Program.
Hello, Gary. Good to be here.
It is a pleasure, man, to get you here out of your office. You are such an incredible busy guy, man, because I know, being a dentist, it's days you probably don't feel like going in, but you got to get there, right?
Got to get there, because if I don't come in, folks don't get seen,
Right, and dentistry, man, is, it's a pretty interesting job. I guess it takes a special person to do this.
Well, you have to love what you're doing to be a dentist, because if you didn't, you wouldn't stay in it long. One of my many roles is I'm also on the admissions committee at the University of North Carolina School of Dentistry. Mm-hmm. And one of the things we look for when we're interviewing applicants is to make sure that they really have the passion to serve their community, to serve their fellow man, and to make sure that they have their patient's best interests at heart.
Mm-hmm. Wow, and I guess, like you said, you have to have a passion for this, because this is something that you do every single day of your life as far as work.
For over 30 years.
For over 30 years. That's a lot of time in there.
Yeah.
Wow. So listen, today our conversation, we're going to touch on the importance of dental hygiene for African Americans, and among other people as well, but the African American community in particular. Now, what I want to ask you, when we talk about teeth, because that's what we're going to be dealing with, I always ask this question: what are teeth actually made of?
Well, they're made of hydroxyapatite.
you see my audience. You see what I mean. See, this is a doctor talking to you. All right.
No, actually, enamel is the hardest substance in the human body, and enamel is hydroxyapatite, and that's basically what teeth are made of. It's not bone, but it's something similar to bone. Teeth, and that's the outer layer of teeth. You've got the outer layer, which is the enamel. You got the inner layer, which is called the dentin, and then you have the blood vessel and nerve supply of the tooth, which is the pulp. And so that's what teeth are made of.
Wow.
Yeah.
So are they like glass? They can break like glass?
Yeah, they can break like glass. You can crack a tooth. And unfortunately, in our community, we've got folks that love chewing on fatback. And or pork rinds, and right. you wouldn't believe how many times folks come in and they've got a cracked tooth, and I'm like, what were you doing? And they say, Doc, I was chewing on that pork rind. Right. So.
And that's not good for you. Yeah. I'll tell you an experience real briefly here. I remember I was eating some hamburger once upon a time, and it had a piece of gristle in it, and I cracked down on it, and it actually cracked my teeth. And
that can happen too. And a lot of times that doesn't happen in a healthy tooth, but if you have a tooth that's compromised with either past decay where you've got a large filling in it, or even current decay where you've got a cavity in the tooth, that's compromised the tooth structure. So if you bite down on something hard, that's a lot of times when you see folks that crack a tooth.
Interesting. Now, Dr. Allison, how often should we have a dental exam and cleaning?
We recommend for the general population, you come in for a checkup and cleaning at least every 6 months, every 6 months. That's if you have a relatively healthy mouth. There's something called periodontal disease, or a lot of people call it gum disease. A lot of the folks, the old time people call it pyorrhea of the gums.
I've heard of that.
And if you have a history of gum disease, we may recommend that you come in more often.
Wow, because pyorrhea, that associated with breath as well.
Well, it can be. And, the pyorrhea or gum disease, periodontitis, is all those are basically called the same thing. It's caused by the bacteria in your mouth getting trapped between your gums and causing the plaque and the tartar that builds up on your teeth. And it's that bacteria, or the bacteria metabolizing the sugars in your diet. That's where the odor comes from.
Now, that brings me to an important question. Now, when it comes to hygiene, does that also affect your stomach? Can it make your intestines disease and all that?
Well, not just stomach, but there is a correlation between periodontal disease and diabetes, and there's a correlation between periodontal disease and heart disease.
I never knew.
Yeah, the plaques that can form in your coronary arteries, or the arteries that supply your heart, which causes heart disease, that usually comes up from the same bacteria that's in your mouth from gum disease.
Interesting.
And with I'm sorry, I didn't mean to
okay.
cut you off. And with diabetes, a person who has uncontrolled diabetes is more susceptible to gum disease. A person who has uncontrolled gum disease is more susceptible. It's harder to control their diabetes. So it's like a vicious circle in terms of gum disease and diabetes. A lot of times, a dentist is the first person to actually diagnose a person that has diabetes, because we're seeing that they have all this inflammation in their gums. They're doing a pretty good job keeping everything clean, but they're still having all this inflammation. So we all ask, have you ever had your blood sugar checked, or when's the last time you've been to your primary care physician to get that checked? And then lo and behold, they found out they have uncontrolled diabetes.
Wow, that's interesting. So what I'm hearing, if I'm not mistaken, that stuff that go into your mouth is one of the first entrance passes that go into your body.
It's the gateway to your whole body health. Yes.
Wow.
Yeah.
So that has to be.
It is definitely it is connected to overall health. Poor oral health can affect your overall health.
So what are some of the most common dental problems that we find in African Americans particularly?
The most common for children is decay, dental decay, cavities. And that comes from it's caused by a bunch of things. Number one, too much sugar in your diet, lack of proper hygiene at home, not brushing and flossing like you should. Probably the most prevalent disease for adults is periodontal disease.
Wow. Now, I hear people often fear people like you. I hear they fear the dentist most often. Why do you find people, what is the reason why you people fear the dentist most often?
Well, and I'll put this for the African American community. I'll be more specific. For a long time, the only reason we as African Americans went to the dentist is when we had a toothache. Either number one, lack of access, lack of funds to be able to pay for it, or just not having anywhere to go, or they knew that if they went to the dentist, there was no one that really wanted to treat them like a person, and they would end up just wanting to pull teeth. That's number one. Number two, probably just the fear of pain, and I think that's the general idea that most people are worried that if they go to the dentist, it's going to be a painful experience. And unfortunately, we have a hard time. That's one of the things we as dentists try to educate our folks that, if you come in for regular checkups, if you come every 6 months, if you develop an issue, number one, we can probably fix it where you are very comfortable for us fixing it. And number two, the cost would be very minimal compared to if you let things go.
Now, what age should a child start seeing the dentist? Because
1 year old.
1 year old.
1 year old. When they first, at 1 year old, they usually have at least 4 or 8 baby teeth. And at that point, you should find them a dental home, whether that be at a pediatric dentist who specializes in seeing children, or a general dentist who does see children. And at that point, it's a pretty simple appointment. And then, we go in, make sure we don't see anything developmentally that's wrong, and then also we use that time to educate the parent on how they should take care of their child's teeth.
That's interesting. Now, are teeth problems inherited from family members? Do you see bone structure or growth that may come down the line?
That's a good question. You have a lot of people say, my father had soft teeth, my mother had soft teeth, and all that kind of stuff. And It's familial, where if periodontal disease, if you're more susceptible to periodontal disease, that might be a familial thing, but it's still preventable if you do the proper things. It's more, some people are more, or their enamel may be more susceptible to cavities, but it's still preventable if you do the proper things. And if you come in for regular preventable care, you're not. It's not going to be a foregone conclusion you're going to lose all your teeth because your father or your grandfather lost all their teeth.
So it's a possibility that it can be a trend.
It can be a trend. Yeah, it can be a trend.
Right. Because I see some people who have, their mother and father may have large teeth, and they too have large teeth.
Well, yeah, now size and shape of your jaws and your teeth, all that is hereditary. Yes. Yeah.
Wow. Interesting. Once again, to my listeners today, we're joining the conversation with Dr. Vincent Allison III, and we're having a wonderful conversation about the importance of dental hygiene for African Americans. Listen, we're going to take a break, and we're going to be right back after this. Don't touch that dial. You're listening to Get With The Program Radio Show. I'm your host, Gary Jones, and we'll be right back after this. Hello and welcome back to Get With The Program Radio Show. Again, I'm your host, Gary Jones. Now listen, today we're joining a conversation with Dr. Vincent Allison III, who is a dentist, a very good dentist. Dr. Allison's practices in Durham, North Carolina. Once again, welcome back, sir.
Thank you. Good to be here again.
All right, my next question here, I often get this question from a lot of people. What ethnicity that you think has the best teeth?
Oh, that's a loaded question. I'll put it this way. Certain ethnicities, I think as far as the actual structure of the teeth, there's not much difference. However, when you look at things like size and shape of the teeth, there are different ethnicities that have certain characteristics. Like a lot of times with African Americans, you may see that their jaws are a little bit wider and their teeth may be a little bit wider. Sometimes I see this with a lot of my Hispanic patients, and I've noticed that their teeth seem to be flatter. And then, with Asian patients, their jaws seem to be a little tighter, and they have probably more problems with crowding, especially if they're lower teeth. So as far as in terms of health, in terms of who's more susceptible to decay or gum disease and that sort of thing, there's really not much of a difference. But you see different characteristics of their teeth.
Now, what are some of the biggest challenges you have faced during a procedure? What has been something that you have often say to yourself, oh, I don't know about that. Here come one of these, because there got to be something that you may say, it's a tough procedure here.
Well, the tough procedure is probably when you have maybe a cavity that you have to work on, or even taking a tooth out, and you've got a very tiny mouth, or they can't open their mouth wide, and just trying to get access, that can be difficult. Dealing with somebody who is very fearful, and they're fearful when they come in. It's like, we got to figure out how a way to get through this, and I don't do any sedation in my office, and I do that on purpose because I in my mind I think it's too risky. There's some dentists that do offer sedation and they do it well, but I just choose not to. And so it's a matter of talking with the patient, using a calm voice, and making sure that you try to keep them calm. And usually that works in terms of getting through. Even with children who are fearful, a lot of times that will work. I can tell you a story one time, though.
Sure.
I thought I was going. It scared me to death, but I had to remain calm. And I was working on it like a 9-year-old kid, very nice young man. And we were doing a filling on a lower tooth, and so we were working right there next to the tongue. And he was doing great. We gave him the injection that numb him up, and he had no problem with that. And we were actually working on the tooth, preparing the tooth to get the cavity out of the tooth. And he was just laying there nice and calm, and all of a sudden he just jumped. His head just jumped. And the handpiece, the thing and most people call the drill, we don't like calling it drill, but the handpiece, when he jumped, it slipped and put probably about an inch laceration on the floor of his mouth underneath his tongue. And I just looked at it and I'm like, okay. But it's one of the things where you have to remain calm. I think that he fell asleep and then he woke up startled, and so it was a good that he was so calm in my chair that he fell asleep, but then he woke up startled, and that's when he jumped. But we just, told the parent about it, and she was okay with it, and we just basically get up. I got some suture, and we stitched it up and kept on going.
Wow. So most often, some of the challenges come about with fear from the patient.
Yeah. That's probably the biggest challenge is just fear, and getting them to come back, because a lot of times we will, have this treatment plan set up and say you've got to get this done, and because if you don't get it done, you're going to end up in pain, or you're going to end up losing more teeth than you need to. And they'll just keep putting it off. And so that's probably the biggest challenge in our profession, is trying to overcome the patient's fear.
Have you ever heard of any stories of a dentist having an accident, perhaps pulling the wrong tooth?
Oh, all the time.
Really?
All the time. That's probably the leading cause of malpractice suits being brought when they pull the wrong tooth. And just like whenever I'm especially let me back up. A lot of times we'll get patients that are being referred from an orthodontist. That's a dentist that puts on braces, and they'll need some teeth taken out, to create space so they can get everything nice and straight. And so I will look at the referral that the orthodontist sent, look in the mouth, get started. Then go back, look at the referral again, look in the mouth.
Make sure
that I'm taking out the exact right tooth that I'm supposed to take out. And I do that anytime. Like if I've condemned a tooth to take out, and they come in for that appointment to take it out, I will double check, recheck to make sure we're taking out the correct tooth. Because yes, that is probably the leading cause of suits in the dental world.
Pulling the wrong tooth. That's amazing. So exactly, because if you pulled the wrong tooth and this person has a good tooth, but they've pulled the wrong tooth. Now the bad tooth is still in there.
Yeah, and you got to get that out.
So they got to get that out too.
Now, if a dentist would do the right thing and say, okay, took out the wrong tooth, now I'm going to make sure we fix it by doing whatever's necessary to replace that wrong tooth that he took out.
Wow, interesting. Now, does our diet contribute to healthy teeth?
Yes, absolutely.
Okay.
Absolutely. One of the things is you can almost predict people some folks we call it Mountain Dew mouth.
Oh, okay.
Because there's some people that will sip on sodas all day long, not drink it with a meal, not drink it, like at night and all in one gulp, but they'll have their Mountain Dew or they have their big Slurpee cup, and they will be sipping on it all day long. So basically, you are bathing your teeth with sugar all day long. And sugar, along with the bacteria that normally it's in your mouth, is what causes cavities, because it's that bacteria eating that sugar that creates an acid, and that's what attacks your teeth and creates cavities.
I'm learning.
And so what we tell folks, we're not telling folks you can't have soda.
Right.
But we're saying you can't be sipping it all throughout the day. If you have a glass of soda with your meal, you brush your teeth, you're fine. And I say you should drink water, to tell you the truth. But I'm just saying, and if you have something sweet, which like some dessert with dinner with a meal, that's fine. But you can't be chewing on non-sugarless gum or sugar gum like juicy fruit all day long, or you're gonna end up with problems.
That's interesting.
Yeah.
What we're gonna do, Dr. Allison, we're gonna take another break. And when we come back, we have some more very good, important questions that I want to reach out to you. But listen, to my listeners, we're joining the conversation today with Dr. Vincent Allison III, and we're having a wonderful conversation, the importance of dental hygiene for the African-American community. Listen, we're going to take a break, and I'm going to reach out now to Steve Rao and Dr. Kimberly McTarian and see what's going on in their world. Be right back after this.
Well, Gary, it's great to be here today on Get With The Program. And the 46th President of the United States, Joseph R. Biden, last week demonstrated to the nation and the world that America is united and strong in dealing with the war against the COVID pandemic. In his address to the nation, the first televised one since he won the presidency, Biden assured the American people that all adults will be eligible for vaccination by May 1st, that by July 4th, we'll be able to get together in small gatherings. And he assured the American people that we will be independent from this virus very, very soon. In addition, he's passed passed a COVID relief bill to put $1,400 checks in the hands of the American people and build our economy. The president inspired a nation and showed us and reminded us that Americans always find our way out of the darkness through the light. And that's exactly what this president has done for our country. We thank him for his leadership. We look forward to continuing the great work ahead.
Okay, now I'm going to reach out to Dr. Kimberly Matera. She's out on location today. Dr. Kim, what's going on in your world?
Well, what's going on in my world is racial equity training. The entire nation is on some social matter about making sure police officers are well trained and making sure that they are racially equipped to handle all forms of society. But does racial equity training really work? Would it have helped George Floyd's case, Breonna Taylor, or even Ahmaud Arbery? Does black officers need the same type of racial equity training as white officers? Do they kill white children? Tell us, where will you be when you see racial equity training offered to your police department?
Hey, listen, I'm Gary Jones, host and producer of Get With The Program Radio Talk Show. You're listening to the talk show at its best. Don't touch that dial. We keep our ear to the community, so don't touch that dial. We got more coming right here on Get With The Program Radio Talk Show. Hello and welcome back to Get With The Program Radio Show. Again, I'm your host, Gary Jones. Now listen, today we're joined in a conversation with Dr. Vincent Allison III, who is a dentist and does wonderful work. And our conversation today is the importance of dental hygiene in the African-American community, in particular all communities, because from my understanding, it's not about, people have some of the same teeth, it's not a whole lot of difference, but it can be. So once again, welcome back, Dr. Allison.
Oh, I'm good. Glad to be here.
Okay, now, before we left, we did talk about you had mentioned about the sugars and the sodas that people drink. What about coffee and tea?
People ask me all the time, or they say all the time, I drink too much coffee, drink too much tea, and that's what's staining my teeth. And that's one of those situations where it kind of depends on the type of teeth that you have, where you get a lot of stain. I drink a lot of coffee. I probably drink 2-3 cups a day, but I don't have the staining problem like I see some other folks have. Mm-hmm. A lot of times, the black teas will stain your teeth a little bit more. And my thing in terms of, it's the same thing I said about, drinking the soda all day. If you're sipping on it all day and you use regular sugar or sugar creamer in your coffee and you're sipping all day, that could lead to problems. That's not as much sugar as what's in the sodas, but it could lead to a problem. Mm-hmm. It could.
Now, I heard this story here from a time I was a child. Why do people call those back teeth wisdom teeth? And is it a myth that does it actually cause wisdom? I mean, what is that all about?
Yeah,
I hear that a lot.
I used to know the story behind that. The only thing I can think that if I remember the story correctly, is just because you don't get them until you're around between 18 and 24. And so maybe you've grown and you've gotten some wisdom. So that's about the only reason that I know that they call it wisdom teeth.
I often wondered that, wisdom teeth.
Yeah.
Now, throughout your experience, do you see any racial disparities with dental care in the African-American community?
Oh, now you're going to get me on my soapbox. Yes. And it's a multifaceted problem. First, probably is lack of access for the lower income, which unfortunately a lot of our African American community is in, where they can't afford care. Also, the problem with getting dental providers to accept Medicaid, which is the program for low income folks to get medical and dental care. Here in North Carolina, we're lucky in the state of North Carolina because in North Carolina, Medicaid provides both children and adult dental services. Mm-hmm. In most other states, they only provide children dental services, but adult dental services are offered for Medicaid patients here, but you just got to find a dentist that accepts Medicaid. I do accept Medicaid, and I encourage all of my colleagues to accept Medicaid. Mm-hmm. Fear is probably prevalent in the African American community because of the way they or maybe their parents or grandparents have been treated at a dental office previously, so they have these horror stories of going to the dentist. Mm-hmm. And just not not being able to get, and the working poor a lot of times have problems with getting to the dentist because of not having the resources to be seen.
Now, in reference to costs, because I heard you mention some of the paying resources. In reference to costs, is there a standard rate for most procedures, or do dentists set their own prices?
No, dentists set their own fees. There's no standard rate that, we're not even supposed to discuss our fees with other dentists because that could lead to antitrust type problems. But generally the fees are pretty consistent. There's a range where you're not going to find too much difference between dental offices. Some may be a little bit more expensive, some may be a little less expensive, and certain procedures in one office may be more expensive in the other office, and then it can flip on a different procedure. And so, but there's no standard fee, but there's a pretty good area of where they fall in a range where they fall in. A lot of that has to do with insurance coverages, because a lot of dentists are now the insurance companies are only going to pay a certain amount. And if you're a dental provider that's in network with a insurance company, you have to accept the fees that insurance company sets out.
Now, when we talk about dentistry, when we look for a dentist, what do we need to look for? Because we're talking about cost and price. When someone's looking for a dentist, what would you recommend that they look for in a dentist?
Well, it depends on it depends on, that's very individual. Number one, you want to find somebody you can trust. I would urge folks to go in, even if you can even try to see if you can have a conversation with the dentist. Go in for your initial visit, and then just see how well you feel you're treated. There's a wide range of different types of offices. You have a small practice like mine is, where there is a small staff and only one dentist, all the way up to where you may have a group practice where you have 3 or 4 dentists in the office at one time, with several other hygienists in the office at one time, and it's a real busy office. Some people like the busy office. Some people like the small office where they know they get to know the entire staff. It's like I said, it's very individual, and you have to just feel like you can trust the dentist, that that the advice that he's giving you is the correct advice.
Now, I notice that I see now with all of the racial disparities and things are going about now, the marches, I find now that a lot of people are tending now to turn to more African-American dentists. Do you think there's a shortage of African-American dentists?
Oh, yes. And I kind of wish I known you were going to ask me this question, because I could have brought you the figures. But I'm thinking from when I've looked in the past, and this is just in North Carolina, the ratio of African Americans, the percentage of African Americans in the North Carolina population, I think is around 20%. You might know this better than I do, but about 20%. And I think that the percentage of African American dentists in North Carolina compared in the total amount is about 5%.
Wow!
So you can see there's a disparity there.
There's a shortage there, definitely.
Now, one thing that I can say that we are really working to combat this issue. The University of North Carolina, the University of North Carolina Adams School of Dentistry, probably since the mid-'80s or mid-'70s, or since the '70s, when they graduated their first African-American dentist, Owen Justice was the first African-American dentist to graduate from UNC School of Dentistry. But since that time, up until now, behind Howard and Meharry, they have graduated more African-American dentists than any other school in the nation. So we're working on it, and also ECU, the new ECU School of Dentistry that's down in Greenfield. They've been around for about, I guess, 8 years now. They also have a good track record of graduating a high percentage of African American dentists. So we're working on the problem, but we started way behind, And so, we just got to catch up.
Right. Absolutely. Listen, once again, today you're joining the conversation with Gary Jones, of course, the host, and with Dr. Vincent Allison III, and we're having a conversation about the importance of dental hygiene for African Americans particularly, but of course other people as well. Listen, we're going to take another break, and we're going to come back with more conversation with Dr. Vincent Allison, but right now I want to reach out to Ursula Camille and comedian Gravedigger. What's going on in your world?
Good day, Gary. Here's a highlight in Black history. George Robert Carruthers was born October 1st, 1939 in Cincinnati, Ohio. He was an African-American inventor, physicist, engineer, and space scientist. In 1964, he began employment for the U.S. Naval Research Laboratory in Washington, D.C., where his work focused on far ultraviolet astronomy. In 1969, he received a patent for his invention, the image converter, which detected electromagnetic radiation in short wavelengths. In 1970, he made the first examination of molecular hydrogen in space. In 1972, he developed the first moon-based observatory, the Far Ultraviolet Camera Spectrograph, which was used in the Apollo 16 mission. One of his inventions captured an ultraviolet image of Halley's Comet in 1986. And in 1991, he developed a camera that was used in a space shuttle mission. George Robert Carruthers died December 26, 2020. He was inducted into the National Inventors Hall of Fame in 2003, and in 2012, he received the National Medal of Technology and Innovation. His telescope he developed is on display at the National Air and Space Museum. Here's one of his quotes. Education and outreach is an important topic because of the fact that students today will be the scientists and engineers of tomorrow. This concludes today's highlight in Black history.
Now I want to reach out to my good friend, comedian Gravedigger. Gravedigger, man, what are you dealing with right now? What you dealing with? You always dealing with something. What's the deal, Grave? What's the deal?
Remember back in the day when you got a girl pregnant, said 3 or 4 years, slept with her, and she got pregnant? Didn't nobody go spend no money on no DNA test? Your mama got together with all of y'all and said, all right, soon as she had that baby, they bring you in the room, and whatever one that baby looked like, that's the one that had to pay for it. But now you got to take DNA tests. They got to swab your mouth. They got to send stuff off to the lab. We had no labs back in the day. You just went ahead, waited them 9 months. You sweated. You had a job because you knew you had to pay for that baby. Right now, babies cost in the thousands of dollars to have a baby. You could have a baby, get a tank of gas, a pack of Newport, a quart of beer, and still have change left out of 100. And women, quit telling folks you got the pretty baby. Because when you ask men, say, ain't this the prettiest baby you ever seen? And most men lie. They'll say, yeah. You ask me, if you got a newborn and you ask me, is this the prettiest baby in the world? I'm going to tell you the truth. I'm like, no, and I hope he grow into pretty.
Hey, listen, I'm Gary Jones, host and producer of Get With The Program Radio Talk Show. You're listening to the talk show at its best. Don't touch that dial. We keep our ear to the community, so don't touch that dial. We got more coming right here on Get With The Program Radio Talk Show. Hello and welcome back to Get With The Program Radio Show. Again, I am your host, Gary Jones. Now listen, today we're joining a conversation with Dr. Vincent Allison III. Once again, Dr. Allison, welcome back to the show.
Thank you. Thank you.
And our conversation today, we're touching the importance of dental hygiene for African Americans. We talked about a lot of good things before we took the break. Dr. Allison, I do want to ask you, do you treat yourself when dentists do dentists treat themselves?
No.
I often wonder that.
No, usually, I'll find a colleague, every so often, to get my teeth clean. And, I get my assistants can take x-rays on me, and I'll look at my own x-rays and see if I see anything going on. But I'll have a colleague look at it probably just once a year.
Mm-hmm. And do you guys pay for y'all dentistry? Y'all colleagues work out things?
Most of the time, for each other, we give ourselves a professional courtesy.
Wonderful. Now, as an African-American dentist coming through the trenches of racism, because, you've been in this for a long time, so you came right at the end of it, sort of on the edge of it. Yeah. Now, did you face any challenges as a black man becoming a dentist during your educational years and even up to now?
Well, yeah. Unfortunately, there are times when, a lot of times when you're graded in dental school, a lot of that's subjective. And you always wonder, if you weren't an African American and one of the instructors looked at your work, would you get the grade that you got? And so I always tell folks, and I tell my students that I work with even today, my African American students that I work with today, that, you have to try to do your best. You need to make sure you try to soak up as much information as you can, but you can't be too worried about the grades. And because I always tell folks that, we as African American dentists, especially if we come through a majority school, more than likely are going to, and I have to be careful how I say this, but I feel that we have to do more to get the same grade. And in saying that, and all this is probably tied to unconscious bias. And I'm not saying that the instructors at Carolina are racist. I'm not saying that. I'm gonna make sure I'll put that out there.
I understand.
But there's that unconscious bias that is still around, that sometimes we get the short end of the stick. But in saying that, if we do our best when we get out, I feel that we're going to be a much better dentist because we've actually had to do better in dental school to get out.
You had to do the work.
You have to do the work.
And I did see maybe a few months ago or maybe a year ago where some students and parents were paying for the students to get good grades to get through college. But unfortunately, when people don't have that kind of money, they can't pay that. So they have to take the classes and do it the right way. Now, does racial bias exist in the dentistry world, period?
Yes and no. I think, the dental profession is a microcosm of society at large. So, you're going to have some folks that are, some of the colleagues that probably have some of those racial bias attitudes. It's going to be out there. I have had some patients that I feel that they've come in as new patients. On this very rare occasions, but have come in as new patients, realized I was a black dentist, and then probably decided not to stay in the practice. That's their choice. If they don't feel comfortable, I want them to be somewhere where they feel comfortable, because they're not going to get good care, or they're not going to be compliant with the care unless they feel comfortable with me as a dentist. So I really don't have a problem with that, but it's like I said, it's out there.
And that was my next question. You almost read my thought process there, because my next question was, do you find that race plays an important role when it comes to choosing the right dentist?
Yeah, and like I said, I think it's different between an African American wanting to go to an African American dentist versus a white patient wanting to go to not wanting to go to an African American dentist. There's a history there that African Americans have not always been treated correctly by their white healthcare providers, that they don't take their problem seriously, or they don't take the time to make sure that they're asking the right questions, and so they feel more comfortable with an African American dentist because they feel like they can trust them more. I mean, that just comes from our past history.
Well, now we did touch earlier before we took the break on in reference to the like of black dentists, and I noticed in reference to like of black dentists an article that was posted in Group Dentistry Now that was posted in June 30th, 2020. It stated that African Americans tend to mistrust the healthcare industry in general and demonstrate a preference for black practitioners specifically. However, finding a black dentist can be difficult. According to a report produced by the American Dental Association, African Americans comprise 12.4% of the population, but only 3.8% of dentists identify as African Americans. Now, this disproportionate number of black dentists may also be evidence of even larger with more barriers facing people of color as they try to study dentistry and participate fully in the industry. So, which means unrepresented dental practitioners, of color, we're unrepresented, basically what it's saying. So when we talked about the lack of African American dentists, why exactly is that happening? Because we know there's a lack of it. What is the problem that you see that we don't have enough dentists? Is it because they're not welcome, or they're not going to school, or it's funding?
If I knew the answer, if I knew the how to solve that problem, I probably would be a millionaire. But it has a lot to do with a lot of, number one, a lot of our people aren't prepared well enough when they leave high school to get into college. Once they get to college, to perform well in college, to have a competitive application to dental school. Sometimes in our colleges, a lot of African American students who may want to go into dental school or want to go into dentistry aren't getting good advice. We have traditionally African Americans do not do as well on standardized tests as our white counterparts. That's been proven. There's a test called a DAT that you have to take prior to going, as part of the application process to get into dental school. And so African American students tend to not score as well on those tests. And see, that's why, when we're looking at students going through the application process, I know especially at Carolina, we try to look at their whole application, the things they've done outside the classroom, their community service, how they've been involved in their leadership, their passion for the profession. And hopefully by doing that, we try to counterbalance the lower scores with what they've done outside the classroom.
We're getting close to the end now. As far as being a dentist, the years, how many years, what is the process? And then you go, of course, get your bachelor degree, and what happens after that?
The dental school is a 4-year program.
Okay.
And most schools is year round. And once you finish that 4-year program and you get your degree, and then you get licensed in a state, because that's it's an exam to get licensed. Then you can set up your shingle and start working. However, there are a lot of students, they'll do something called a general practice residency, or they'll do an advanced education residency program, which gives them like an extra year of training, kind of under the supervision of a senior dentist. Some dentists, some want to specialize, like they want to go into orthodontics, or they want to be an oral surgeon, or they want to be a endodontist. That's a dentist that deals with mostly root canals. Or they want to be a pediatric dentist, a dentist that specializes in seeing children. Those programs usually are either 2, 3, or 4, and some 5-year programs after dental school.
So it is some years. So we're looking at probably about 12, maybe about 18 years of schooling. If you're specialized, the longer residency programs are the oral surgery programs. And so if you want to be an oral surgeon, you'll probably have 4 years of 4 years of undergrad, 4 years of dental school, and 4 or 5 years of residency. Wow. Yeah. A lot of schooling there. Yeah. Now, like I said, I didn't do a residency. I came right out of dental school and went to work. I'd basically been in school year round from the time I finished high school to the time I finished dental school. So, I was ready to go to work. That's good. That's a blessing, man. I tell you, Dr. Ellis, it's been a pleasure having you here today. Now, your website, what is the website that we can get in contact with? My website is www.AllisonFamilyDentistry.com. Okay. Now, any last words for, let's say, for instance, a student is listening to the show now, and you've been in this business for a while. What would be some encouraging words that you would like to say to an up and rising young African-American dentist? Dentistry is a great profession. It's competitive, but it's very competitive to get in there. So I say, while you're in your undergraduate years, take advantage of any opportunity that you can get as far as volunteering, shadowing other dentists, doing what you can to have the best grades that you can get. Take advantage of office hours, go see your professors, take advantage of any extra credit that you can get. Do anything you do to improve your application, you need to do. Wow. Good information, Dr. Vincent Allison. Thank you so much for joining with me today. You're quite welcome. Glad to be. I hope I gave out some good information. Oh, man, that was some incredible information. My listeners, I'm sure they are smiling right now. That was some good information, particularly the one about the wisdom tooth, because I questioned that. Because, when you pull that wisdom tooth, I was like, are you pulling my wisdom out? Am I going to be dumber? Wow. Once again, thank you for listening to Get With The Program Radio Show. Again, I'm your host, Gary Jones, and today we was joining the conversation with Dr. Vincent Allison, who is a dentist, man, a really good dentist, has a family practice and a cosmetic dental practice as well. Wonderful show, sir. Thank you so much. All right, thank you. All right, as I say always, keep your head up, stay positive, and remember to
Get With The Program.
What you talking about?
The program. Get with the program.
Everybody clap to this. Say what?
Get with the program.
It starts now.